We're going to go ahead and start this presentation. So thank you everybody for coming and joining us to learn a little bit more about your eye and your eye health, especially during this amazing digital age we're in. So just a couple housekeeping items to start. You'll notice on the bottom of your screen there is a mute button, and as of right now I have everybody muted except for Dr. Copeland, just because she's going to take the floor here in a second. But that way if somebody runs across and their dogs are barking or kids are screaming or something like that, that doesn't necessarily interfere with her presentation. You'll also notice that there is a stop video button down there. We will be recording this for future purposes, just in case people aren't able to make this live webinar. So if you are comfortable having your camera on and recorded this for the replay, you can leave that on. If you would like to have your picture off, you're welcome to hit the stop video button, or you can message me and I'll tell you about that in a second, and I'd be happy to take that off for you. The other piece is if you have questions during the presentation, there is a chat feature that you can access on the bottom of your screen, and that will open up a window off to the right and allow you to ask either everyone a question, pose it to the public, or you can send them directly to me. I'm Dr. Ellen, by the way. And so you're welcome to shoot those to me, and then I will let Dr. Copeland know those questions when it's appropriate in her presentation, just to kind of keep the flow. So don't hesitate to use that. In the chat section, there is a blue bubble that you can click, and it will open up a menu that allows you to decide if you want to make that chat public or if you want to send it directly to me. It's totally up to you. So if anyone has any other questions, use that feature. Otherwise, we're going to get going. So thank you once again for being here. I am Dr. Ellen. I own MindsetPT, which is a performance and rehabilitation company here in Kalamazoo, Michigan. And so our effort and our hope with this program is to continue education, to get out information to the public. Even though we can't necessarily be together one-on-one for this, we can be together in the digital spirit. So I want to present Dr. Alexandra Copeland. She is an amazing resource in eye health here in Kalamazoo, Michigan, and I can't wait for you guys to hear what she has to say. I've already seen the presentation and it's amazing, so brace yourself, but Alexandra, the floor is yours.
All right, perfect. All right, let me just figure out how to share my screen again. There we go. All right, so thank you, Dr. Ellen, for having me on the webinar, and for everyone tuning in. I see some familiar faces that I haven't seen in a while, so thank you for joining me. I just thought I'd start off here just telling you a little bit about myself if you're not familiar with me. I am the owner and optometrist of Innovative Eye Care here in Kalamazoo. It is my private optometry office. So I am a graduate of Boston College. I had my undergraduate degree there in biology, and then I went to the Illinois College of Optometry for optometry school, did a one-year residency at Salus University in Philadelphia, which is for low vision rehabilitation. I'm a fellow of the American Academy of Optometry, and then locally, I'm a co-chair of the Southwest Michigan Optometric Society and a board member of the Texas Township DBA, and then a member of the Kalamazoo Junior League. And I live in Kalamazoo with my husband and my 11-month-old daughter, who's kept us nice and busy during quarantine. So that's been good. And then the other thing I just thought, before I go in more talking about digital devices, is just exactly what an optometrist is, because a lot of people don't really know, or they just get confused because there are two different types of eye doctors. They're both eye doctors. I'm an optometrist, and then there's also an ophthalmologist. These sound very similar too, so I think it just gets confusing to people. So I'm an optometrist, so I went to college for 4 years, and then I went to optometry school for 4 years, and I graduated with an OD degree, so Doctor of Optometry. I think the best way to think about an optometrist is just as a primary healthcare provider of the eyes. So anything you would, you go to your primary care doctor for general health. And so that's what you think of for eye optometrists, although there are specialties within optometry, but we're looking at the overall health of the eyes and make sure everything's functioning like it should be. So that would be annual visits, urgent care visits, like if you woke up with a red eye, scratched eye, something like that, it could see you. I'm able to dilate your eyes, which is a requirement for diabetic eye checks. And then if you had a red eye and needed some medication, I can prescribe that as well. And then obviously with eye health goes along with glasses correction. So I'm able to prescribe glasses and contact lenses. An ophthalmologist goes to college, and then instead of going to optometry school, they go to medical school. So then they go, which is just, general medicine. So they graduate with a doctor of medicine, and then it's their residency that they do in ophthalmology is when they specialize in the eyes. And this is a surgical specialty. So for ophthalmologists, they're the ones who are doing cataract surgery, LASIK, if you knew someone who had an eye turn and needs that corrected. An ophthalmologist, or if you know someone has to get injections into the eye, an ophthalmologist does that as well. It gets confusing though, because an ophthalmologist also does these primary eye care things that an optometrist does, but they truly are a surgical specialty. So that's just kind of the difference if you weren't aware of that. So before, again, talk about digital devices, I just wanted to talk a little bit about the eye itself. So the eye is connected directly to your brain. It is part of the central nervous system. And then basically the eye's job is to focus the light from the outside world. So what you're seeing, the eye focuses that to the back of the eye, where it then sends that message to your brain. And then your brain interprets that message to tell you what you're seeing. So in reality, it's actually your brain that's seeing and not your eye. This is a slide just of some eye anatomy, just some stuff that I'll be talking about during my talk. So just wanted to show you that up front. So this is just a cross section of your eye from front to back. The front part of your eye, it's kind of, we can think of it as a clear dome. Something I didn't know about the eye before I went to optometry school is your eye's not really just one circle. It actually has this kind of dome on the front, the clear dome, that's your cornea, that's what you see out of. So when you're like someone who wears a contact, that's where the contact's sitting on your cornea. So your cornea is clear because you have to look through it, and it helps focus the light to the back of your eye. The colored part of your eye is called your iris, and then in the middle of your iris is your pupil. Your pupil is actually just an empty circle, just an empty space, really. It forms a circle, but an empty space that any eye doctor can look through to see the back of the eye. So when you dilate the eye, it stimulates the muscles in the iris to contract, so that circle becomes bigger, so you have a bigger view, but it's just an empty space. So fun little fact, if you want to share this with your friends later today, is that when you get a red eye in a photo, that's just your retina, the blood vessels in the back of your eye being reflected through your pupil. So that's actually why you get a red eye in camera photos. Behind your iris, this right here is called your lens. This, along with your cornea, these two structures focus the light to the back of your eye, your retina. Your lens has, you can see these little strings, the fancy name for them is zonules, and these actually pull your lens to change its shape. So they help you adjust the focus. So when you're looking at something up close, like a computer, your lens has one shape, and then when you look far away, it has a different shape. And that's controlled by these little things here called zonules. As you get older, this lens gets hard and it gets kind of discolored. That's what a cataract is. So that's a part of your eye where a cataract forms. And so as the cataract's forming, this lens is getting harder. Those little strings can't pull the lens like it used to. So that's why people need reading glasses. And that's also why people, when they start needing reading glasses, they have to, if they pull things further from their face, it's easier to see because that lens doesn't have to change shape as much. So the lens is pretty important structure in our eye that most people are aware of because of cataracts. So then the entire back of your eye is lined with your retina. There's a special part of your retina called your macula that lets you see your best. And then your optic nerve is what sends the information from your eye to your brain. So again, the focus of this talk today is about digital device use in your eyes. When I'm talking about digital devices, really talking about any electronics with a screen. So this could be a desktop computer, laptop, cell phone, tablet, anything electronic with a screen. So when we're looking at a digital device, we're looking at it up close, so we can essentially think about it as a near vision task. So when we're doing anything up close, we have just natural changes to our eyes. So our eyes turn in, our focusing system engages those zygotes pull that lens to change its shape, and our pupil gets smaller. So that happens whether or not we're looking at a computer screen, but anything we're looking at up close. So when we're doing a lot of near work, those three things, that focusing triad, we call it, it just gets stressed out. And we can think of this basically because in the general scheme of things, digital devices have really not been along for that long in our human history. So just a small amount of time that our eyes have had to work on digital devices. So they're really not adapt for looking at something up close for hours on end. And even, you know, some people are more sensitive where they don't have to look at it for that long, and they do get these symptoms of overworked eyes. So symptoms of overworked eyes, you can have some of these symptoms, a combination. They can kind of vary from mild to severe, depending on how much near work you might be doing. So headaches, particularly headaches that are like frontal headaches, kind of by your brow bone or your temples tends to be the location, although it could be your whole head, you get a headache. Eye strain, so your eyes are just kind of feeling uncomfortable. You might feel like you have to blink or rub your eyes a lot. Being tired at the end of the day. Again, this could be your eyes or your whole body. You just feel tired after you've been on the computer. Blurry vision, so your vision kind of coming and going throughout the day or while you're on that computer. You're on the computer and then maybe you look up to try to talk to someone or maybe read a clock and you notice it's blurry. That can be a sign that you're been doing too much near work. And then you might even experience some double vision. So we're going to look into ways that we can kind of prevent these symptoms from happening. So there's 4 things I'm just going to touch on today. It had been originally 3 B's, but I added a 4th. Working distance, I thought that was important. I couldn't really come up with a B word for working distance. So there's working distance, brightness, blinking, and then taking a break. So working distance is just what it sounds like. It's just the distance that you are from your device. So your computer screen, again, whether it be a desktop, laptop, your phone. So that's what we're talking about with working distance. Now, the closer you're holding that electronic device to your face, the harder your eyes have to work to read that device. So unfortunately, when they've done some studies, they show that when people are on digital devices, even if they kind of start out for a further distance, they didn't go into why, but they just found that people tend to move closer to their devices as they're doing their work. So this is just something to be aware of while you're working. So the optimal working distance is about 20 to 28 inches away from your computer screen. So you might not really think about this when you're set up, but you could measure the distance to see if that's where you are, if that's where you're already kind of locked into sitting. If not, you might want to move a little closer or farther. I'm guessing you're probably sitting closer, if anything. And then you do want to be looking a little bit down. So the center of your screen should be about 4 to 5 inches below eye level. Definitely don't want to be looking up at a screen. It just puts more strain on the eyes. And then again, just kind of thinking about how far you're sitting in. And I know someone was talking about this with kids. They definitely tend to pull screens closer to them while they're working. And a really good thing, I didn't put this in here with kids or really anyone, just to check in, is the distance. If you put your fist under your chin to your elbow, so that like forearm length is a good marker for how far away you want to keep your like tablet or phone from your face, just to decrease that focusing demand on your eyes. All right, so the next thing would be brightness. So Brightness is related to glare. So glare is a visual sensation or like a visual disturbance that's caused by excessive or uncontrolled brightness. So it's just harder for our eyes to resolve or read and process what we're seeing when the brightness is not at the right level, when there's too much of that. So sources of glare could be that digital screen itself, or it may be the environment that you're working in. So it could be some overhead lighting or the work surface, so where you have your computer on, that could be causing some unwanted glare. So when we want ways to reduce glare, so your device itself would be to adjust the brightness level. So you can just go in and change that level, and I would say just to make that originally just kind of see how you feel comfortable looking at that with that brightness. But really your goal is to match the brightness to your surroundings. So once you go in and change the brightness, you want to then compare your screen to the surroundings that you're in. If that screen seems like it's like emitting light itself, that it seems like it's its own light source, that's an indication that it's too bright. Whereas if the screen then seems kind of dull or gray, that's an indication that it's too dark. So I just want to can make some minor adjustments. Your work environment. So working at home, you may not have as much control over this, but you just want to position your computer screen or your electronics so that you're avoiding getting reflections off that screen from things in that room that you're working in. So overhead lights or windows. Again, if you're in a space that you're not normally in at home, you can think of maybe putting some blinds or drapes up to limit the light from maybe a window that you're in the room. And then again, the work surface, if you're on a shiny surface, that can reflect light from up above back at you. So maybe you have to put down a tablecloth or something like that to prevent those extra reflections. So then the next thing to think about is blinking. Blinking is usually something that we don't think about. It's our eyes' natural way to stimulate the release of tears and then help spread the tears along the surface of our eyes. Our tear layer is just a very microscopic layer that sits on the surface of our eyes. It's only about 4 to 5 microns, but it's actually very important for how well we see. So the two main things that we can think about our tears do and are affected when we look at devices is that they help lubricate the eye. So again, blinking helps stimulate the release of tears and spread them along the surface. And then it also provides us clear vision. So we need to have a nice smooth tear layer to see well. If we don't have a nice tear layer and it's kind of broken apart, again, we think that light enters our eye. So instead of just going directly back, it's going to be kind of scattered around. So our vision is going to be blurrier. It also provides protection to our eye because it's that outside layer. And then it provides nutrients to our eye like oxygen. So when they've done research and they have people on digital devices, it actually shows that people blink less frequently and completely when they work on a digital device. So when you're staring at a device, like a concentrated near task, even reading, but when they're looking at computer work, people blink about 1/3 to 3 to 4 times less often than they would if you were just talking to someone in normal conversation. They also tend not to close their lids together completely. And so again, if you're not blinking as often or as completely, you're not spreading those tears or releasing those tears as much as they should. So that leads to your eye being dry. So symptoms of dryness, just like eye strain, these can vary and you might get a couple or maybe just one, and it can be kind of mild to severe. So again, just your eye feeling dry. Blurry or fluctuating vision. So again, that has to do if you don't have that nice smooth tear layer to start off with, then that light's going to get scattered around more. So your vision's going to kind of go out in and out. And so a symptom would be if you actually stop and blink your eyes and you feel like you're seeing better after you blink your eyes, you've refreshed your tears. So that can be a sign that your eyes are dry. Difficulty wearing contact lenses. So maybe you've never really had a problem with contacts and now you're at home on the computer and you feel like your eyes are really bothering you with your contacts in. That can be a sign your eyes are dry. Basically, they are a little dry, and then just putting that foreign material in your eye just kind of kicks them over the edge of feeling really dry. Watery eyes is a symptom of dryness. This sounds very strange because it sounds like the opposite. If your eyes are watering, why are they dry, or how come? That doesn't really make sense. So that's related to, you have two types of tears. Again, when you blink, that releases the tears that are found in your eyelids. And those are the tears that help, again, keep your eye moist and protected. And then you have tears that are made by a tear gland that's kind of up in your brow bone. And those are called your reflex tear system. So that's like if you got something in your eye and all of a sudden your eye starts watering because you need to get it out, or if you're crying, those are your tears related to that. So when naturally your tears from your lids are doing that main lubrication, well, when your eye's not blinking well, your eye's not getting enough of those tears. So it starts telling your reflex tears that your eye's not moist enough, so to start making tears. So those tears are just too much for your eye. They're really supposed to be kind of washing out your eye. So that's why you end up getting that watery eye. A red eye, that's related when your eye is dry, your blood vessels tend to dilate. So your eye looks redder. A gritty or sandy feeling. So your eye may feel like there's something in there, even though you know there really isn't something in there. So that's because of that surface. You don't have that nice smooth surface. Every time you blink, you're rubbing against that, so you can feel that. It's kind of, think if you have a dry hand and you have a rough patch there, if you rub against that, it's uncomfortable. That's just like the surface of your eye. Burning or stinging, again, just because you don't have that nice smooth tear layer. And then just like an overall feeling of your eyes not feeling well. Those are all signs of dryness. So what can you do to help reduce the risk of dry eye? And most of these things you can do, or at least the top two, with things you probably already have at home. The first one is just actually to think about blinking. So it's blink training. So your goal would be every 20 minutes to actually stop and think about blinking. So there was this doctor that just developed these two exercises. So the one was just to stop and close your eyes normally just for 2 seconds and then open them, again, to help spread the tears along the surface of your eye. And then the second one would just be to close your eye, but then squeeze it shut. That helps stimulate the release of the tears, and then open them back up. So just basically to take some time to think about blinking, because you're likely not blinking as much as you should be. So if you're doing this more regularly, again, the goal is every 20 minutes, but if you're doing it more regularly, then you don't have to think about it as much. It just becomes more of a habit. Doing a warm compress on your eyes helps release those tears that are found in your eyelids. It is the best to use an actual mask. So if you have a dry eye mask, if you have problems before, or a sinus mask, any sort of, or beauty mask that you can heat up and just holds the heat. You can use a washcloth, again, if you weren't to have one of these at home already. The washcloth just doesn't tend to warm up as warm as a mask or stay warm for long enough, so it's just not quite as effective. But if you had a washcloth, you could put it under some hot water and then maybe just pop it in the microwave for a couple seconds to warm it up even more. You do want to be careful though, because your eyelid skin is very sensitive, so it might not feel too hot to your fingers, but it's going to be warm on your eyelids. So you just want to rest that warmed up compress on your closed eyes, and then the goal would be for 5 to 10 minutes once a day. So again, if you don't have a sinus mask, something that you can hold the heat, you might have to heat up that compress a couple times. Artificial tears or lubricating eye drops. This would be if you have some already at your house. So you can just put these as needed for dryness. I'm always surprised when people say they use tears and say I use them like once a week or once a month. I mean, they're fine because they lubricate your eye at that time, but if you're just using them that infrequently, you're probably not getting that much of a benefit from it. Again, I kind of use the analogy to your hands and lotion. An artificial teardrop, a lubricating drop, ones that are just labeled as that, they don't have any extra medication in them. So they're not doing really any harm to your eyes. So you can use them more often, about 2 to 4 times a day. If you do use them more than 4 times a day, you want to go for a preservative-free formula, because that preservative in the tears, if you're using it often, can start to irritate the surface of your eye. But just moisturizing your eyes. If you think if you were to put lotion on your hands every day, your hands are likely to stay moist and they're not going to be dry and cracking. I'm really bad at doing that, so my hands get dry and crack, and so I have to put lotion on them, so I'm not really preventing them from reaching that state. So that's the same thing with tears. If you're using them on a regular basis, it can prevent your eye from feeling very dry. Now, tears, if you don't have any tears at home, this is not the same as just like splashing water into your eyes. Those tears are sterile, and then they also have some properties that are just more moisturizing, and they're made to match your natural tears. So you really should not splash water into your eyes because it's not sterile. So we don't want to be introducing something that could cause an eye infection. And then again, I said most tears, again, if you're just getting artificial tears or lubricating eye drops, they don't have a medication in them. However, tears that say get the red out, they do have an added medication in them. That added medication, it makes your eyes white by constricting your blood vessels. So when your blood vessels are smaller, your eyes are not going to look as red. The problem with this is, though, if you continuously use that drop, those blood vessels feel like they need that medication to be small. So when they don't get it, when you don't put that drop in, they dilate. So it's called rebound redness. So now your eye looks maybe even redder than before you started using the drops. So you got to put a new drop in. So it's kind of this cycle where your eye becomes addicted to the drop. So in that sense, you want to avoid the get the red out drops. And again, if you're doing things to prevent your eye from being dry, your eye shouldn't be getting as red as you may have had an issue with. The last thing here is just taking a break. So when the goal as an optometrist, we have this 20-20-20 rule. So after 20 minutes of near work, you want to take a 20-second break and look 20 feet away. So again, this rule just means that when you're doing near work, to think about actually taking a break and looking off in the distance. This is, again, has to do with how that lens inside your eye naturally changes its shape to change your focus from near to far. So if you're looking at a computer for a very long time, your lens just gets locked in for up close. And instead of being flexible like it should be, it's harder to change that focus. So that's why if you looked up at a clock, it seems blurry, because your eye should naturally be able to adapt pretty quickly, but it's just so locked in for up close that it can't do that. So just taking some time to take those breaks every so often helps it prevent from being locked in. The other thing, this is not related, if you don't have these at home, it's not something that you can do now, but if you are doing a lot of computer work, something to think about would be to get a computer-specific pair of glasses. And these help relieve eye strain by correcting even a small amount of refractive error. I'm going to go into what refractive error is on the next slide. They help reduce eye strain by just relaxing your eye's naturally focusing system. They also reduce glare, and they reduce blue light, which I'm going to talk a little bit more about blue light coming up here too. So refractive error, when the light enters your eye and your eye has to focus that to the back of your eye, that process is called refraction. So again, the goal is for your eye to focus that light directly to the back of your eye. If it's not doing that, then that's called refractive error, and that's when someone sees blurry and they need to get some glasses. When you're looking at things that are bigger and you're not staring at fine details, maybe your focusing is a little bit off, but it doesn't really bother you that much. You're still able to see what you need to see. You can make out things and you don't feel like you're missing something or straining to see it. But if you're, looking at a spreadsheet all day with really fine numbers, that little bit of blurriness becomes more apparent, particularly after more and more hours looking at that. So this is just a graphic that shows you how the eye focuses light. So up on the top here, this is just how your eye should focus light. So that cornea, that clear dome on the front of the eye, and the lens inside your eye, they focus the light to the back of your eye, your retina. So in hyperopia, which is when the eye focuses the light behind your retina. So in layman's terms, a lot of times we call this farsighted. It's because the light rays are going too far from the retina. So we got to wear glasses, or someone has to wear glasses to pull that light focus forward. And then the opposite would be myopia, where the light focuses in front of the back of the eye, so or too near. So this is called nearsighted, and we have to wear glasses to push the light focus back. So that's why people need glasses. And again, even if it's just off just a little bit, it might not bother you in most tasks, but if you're doing something more detailed, concentrated, that little bit of blurriness just contributes to your eyes feeling tired because they have to work harder to figure out what you're seeing. The other thing, again, we talked about glare. So glare has to do with light reflections. So there are treatments to lenses that help reduce the reflections actually off the surface of the lens. So this is just, Crizal makes one of these products, and in this picture you can see you have some halos and extra lights around the light sources themselves. That's without the anti-glare. And then with the anti-glare, they become more of a pinpoint light source. So you're just not getting as much light scatter. So that helps reduce your eye strain. It also lets the light, instead of bouncing off the surface of the eye, it lets it move in towards your eye. So more light towards your eye means better sight. So that's important as well. So that's a clear treatment on the lens, and it's gonna block all light equally. So it's not targeted at a specific wavelength. Blue light, if you already spend a lot of time on the computer, you may be aware, have heard about blue light, or because blue light's kind of a hot topic, I think, in eye care right now, just because of how much time we spend on devices. You might have gotten like an ad pop up on some website you're on for blue light blocking glasses. So why do we care about blue light, or why is that such, why does that seem to be coming up a lot? Blue light is just part of our regular visual light spectrum. So it is on the shorter wavelength spectrum, so it's closer to ultraviolet light. And we know that ultraviolet light isn't good for us. Blue light, because it's a shorter wavelength, it carries more energy. So sometimes blue light is called high energy visible light, or HEV. Blue light comes from many different places. Actually, the sun gives off a ton of blue light, fluorescent lighting, flat screen TVs, and then any, again, screen displays like computer, e-reader, tablet, smartphones. So those are all giving off blue light. So why is there kind of concern about blue light and the eye? Well, your eye does not block blue light very well. So the cornea and your lens do block a lot of UV naturally, so they prevent that UV light from reaching the back of your eye. So, you know, glasses, lenses do have UV protection, and a lot of that protection has to do with protecting that delicate skin around your eyes, because internally your eye does block UV. The cornea and the lens, though, do really not block blue light. So that blue light's able to go to your retina, and the concern of this is because it's high energy, it has more energy to potentially damage the cells in your retina. So when they've done studies in rabbits, they've shown that intense exposure to blue light has led to the damage to the retina similar to macular degeneration. I haven't really been able to extrapolate this into human studies, but it has been shown in animal models. Now, blue light, because it's short wavelength, it also causes more light scatter, so kind of more glare, so that's going to contribute to eye strain as well. So again, why really be concerned about blue light from digital devices? Because the sun emits way more blue light than the device, but the concern is just how much time we're sitting in front of electronics, and also how close they are to our face. So that's part of the argument versus, you know, why we should worry about this. And then blue light also is part of how our sleep cycle, so our circadian rhythms, this is why your eye doesn't naturally block blue light, because we need blue light to tell our bodies when to go to sleep. So if you think the sun emits blue light, so when it's sunny out, the high blue light, our melatonin levels are low, so we're not tired. And then when the sun goes away, there's less blue light, so the melatonin levels are up, and we start to feel tired. Now, if you're looking at a device that's emitting blue light, you're getting more blue light from an artificial source, so that sleep cycle might be off. So that's why on your computer or like your phone, you can set those settings like nighttime mode, so that blue light is decreased, so you're not messing with those your natural circadian rhythms as much. So that would be ways to protect your eyes from blue light. So again, just setting that blue light filter on your computer screen. Again, a lot of times these are night settings, but people who are more sensitive to blue light, especially that light scatter or glare that it produces, just lowering the color tone of your computer can be helpful. And then incorporating a blue light protection into glasses. Yellow tinted glasses block blue light the most, so that would be your most protection against blue light. While we don't really want to wear yellow glasses all the time, again, we do need blue light to help do our sleep cycles. And then a lot of times, just cosmetically, people don't want to wear yellow glasses. However, if you had a computer specific glasses, you could think about that. But otherwise, because of more interest in what blue light does to our eye, there are clear filters that can be made into or incorporated into our glasses that help absorb that blue light while letting the other blue light through that does our circadian rhythm, so that we're not getting as much and we can still wear a clear pair of glasses. So that's basically all I was going to talk about today. So again, ways to reduce eye strain would just be to think about how far you're sitting away from the computer, how bright that is, or internally in the room if you're getting unneeded light reflections, stopping to blink every so often, and also stopping to just take a break from doing that near task. So yeah, I just want to thank everyone for listening today, and I'm not sure if there are any questions that came in or any questions people have about general eye care that they've been worried about while they're at home. I'm happy to answer that as well.
Yeah, so at this time, go ahead and use the chat feature located on the bottom. If you click on that, you can notice that there's going to be a window that pops up to the right, and so you're welcome to write anything in there. But Alexandra, thank you so much. Now, we do know that some people on here have kiddos. So let's say you've got a kiddo who likes to spend quite a bit of time on their phone or a smaller digital device. Do you have any recommendations about what happens, how those little things that you could do to get your kiddo to either take a break from the screen time, or as well just say every 20 minutes set an alarm and you're going to go in there and they got to look 20 feet away, or some of those other tricks that you might have for kids?
Yeah, so I think that it's called the Harmon distance. So just from your, like, if you put your fist like this and then your elbow, so if you have your kid put his hand under his chin, and then you want that device at the end of the elbow. So that's a good thing if you see your kid going closer and closer to their device. For whatever reason, they do not need to be that close to the device. So you want to remind them that's just like a good thing, and it's related to the child. So your arm length is different than mine, but that's the arm length we want for that person. And then, like you said, just really encouraging them, every so often, those 20 minutes is ideal to take a break. Just help to relax the focusing system. Kids' eyes focusing system should work really good. It's really strong, but it can get overworked if they're doing a lot of your work.
Very good. Okay, beautiful. And somebody else had a question about using those artificial tears and the lubricating eye drops while they have contacts in.
Yes. So if you go to the pharmacy area, they do have specific teardrops that will say for contacts. So you can put those in. Definitely with the artificial tears, probably the biggest thing when you have a contact lens is if it's too thick, it can coat the surface of the lens. So you want to stay away from a gel drop if you're using a contact lens. And then I would probably say, you know, to start off with a preservative-free formula, because if you're wearing a daily lens and throwing it out at the end of the day, it's not as big as a deal. But if you're wearing that same lens like the whole month and you're putting that contact or that drop in that has a preservative in it, using a preservative-free formula, because that preservative is just going to be staying on the surface of the lens or maybe incorporated into the lens and causing some irritation. So I would go, ideally you'd want to get a made for contact drop, but otherwise definitely using a preservative-free and staying away from a gel drop is good to do with contacts.
We had another question about, what do you recommend for itchy allergy eyes? And how about the eyes that feel like they are burning?
Yep. Allergy-related itchiness, our tears drain from the corners of our eyes. So if your eyes are itching like really towards the corner where your nose, that's where your tears pool before they get drained. So that's where that allergen is going to collect. So that's a sign that your eyes are itchy because of allergies. If your eyes, like the whole thing itches, particularly by your eyelids, that's probably more of a sign of eyelid irritation or eye hygiene kind of thing versus allergies. So actually over the counter, you can find some good anti-allergy drops. Patanol or Pataday was a prescription drop that just like this spring came off prescription, is available over the counter. Aloe or Zatador, so those are all antihistamines, anti-itch. So you can use those. It usually is, if you have bad eye itch from allergies, it's better to use a drop on your eye versus taking oral antihistamine. It just treats it more. The other thing too, if you use a nasal spray, because those passages are connected, sometimes that will help relieve people's itching eyes. If you don't really need, I mean, if your allergies are bad and you have to take like a Zyrtec or something like that, by all means, don't skip that. But that antihistamine is drying everything out to help relieve your allergies. So it's going to make any sort of dry eye symptoms worse. So if you don't really need to take an oral antihistamine, if you can do something a little bit more local, it tends to be less drying. If your eyes are itch or burning, that again usually has to do with your tear layer being not very thick or robust. So you want to, I would probably reach more for just a lubricating artificial teardrop versus an anti-itch one. Does that make sense?
Yeah, absolutely. That's really good information. So somebody else had a question about, do I have to wait a certain amount of time to put my contacts in after using artificial tears?
You don't really have to, because again, artificial tears, they're just lubricating. I mean, if you waited maybe 5 minutes, but that's probably being pretty conservative, just like a couple minutes to let that wash out. That preservative would be good, but really 5 minutes would be good. The other thing, like when you're doing makeup with contacts, a good thing to do, because sometimes the makeup can get onto our eyes. So like particularly with mascara, so you can apply your mascara and then kind of let it dry and then put an artificial tear in your eye and help kind of wash maybe anything of that away. And then once you waited 5 minutes, then you can put your contact on, so then you avoid putting mascara on and possibly getting that onto the contact.
Okay, perfect. Now this might lead into this next question about, you mentioned the eyelids and some eye makeup and such. What are the styes that can form on the eyelid?
Yep. So that's what those in our eyelids, those tear glands that we have, they're actually oil-based tears. So we have about 50 glands distributed between the top and the bottom. So those pores of those glands are located right by where our eyelashes are. So sometimes women put or not mascara, but eyeliner on that ridge that's along our eye. So that's where all those oil glands are located. If those oil glands get clogged, that's what a sty is. And so it's basically kind of just having a pimple along that eyelid margin. So actually you want to avoid lining your eyelid for women on those glands, because you're just covering up those glands and clogging them. So prevent contributing to your eyes feeling dry and potentially getting styes. Those styes, we just have natural bacteria that lives on our eyelids, and they're oil-based glands. So that bacteria just likes to feed on those glands. So doing that warm compress can help those oils not be as clogged.
Okay, perfect. And now somebody else asked a question about, you showed the difference in nighttime glare. Can prescription glasses be made to reduce glare?
I'm sorry, you kind of, either I froze or you froze right in the middle of that question.
Sorry about that. Somebody said, you showed the difference in nighttime glare. Can prescription glasses be made to reduce glare? And I think the answer to that is yes.
Yeah, so I would say, so that graphic shows you more nighttime glare reduction with lights, but I prescribe anti-glare treatment to all my patients. A lot of times, or it's just a question for people to get it as an add-on, but really it's essential for us to see well, because I mean, I'm sitting in a room right now with overhead lighting. Throughout your day, you're getting lighting from all sorts of different sources. So that anti-glare is going to help you in all situations, not just night or the computer. So it really does help reduce those reflections and help reduce glare.
Awesome. And then it looks like this is the last question, but if anybody has any more, these are wonderful. And this is not just information that's good for the person who asked it, but chances are other people want to know this too. So thank you everybody for submitting those. The last question was asking about, have you read anything about the reason kids have behavior change with too much screen time? And then with regards to that, with regards to the ocular health. Or optical, excuse me.
I didn't really, go into like any mental things about screens, but I do know, or you may already know this too, that there are studies that show that, screens or electronic use is addictive, that it's when they study like teenagers' brains that do a lot of computer, like gamers and things like that, that their brain shows the same similar structures of addicts, that people that are addicted to alcohol or drugs. So it does have an addictive quality to it. So as a parent, you really need to put those measures in place to say, you need to take a break every so often, because your child might not be able to do that because they're actually like physically addicted to this device. So just really putting a plan in place. Again, we're doing online learning and your kid's going to have to be on a screen, but just making sure too that when you think about digital devices, what is the content they're viewing on the device too? Is it an educational thing, or is it just like watching TV and YouTube, where it might not be something that's really activating, learning? But again, it is studies do show that it's an addictive thing. And all those things I talked about, blinking, breaking stuff, we think kids' eyes are healthy and they very adaptable, but more and more it's showing that kids have dry eye, which is something I think 5, definitely 10 years ago, you never would have thought a kid would have had dry eye, because their tears were just so robust, or even their focusing system, they're having hard time seeing the board at school, not because they can't see, but because their focusing system is so overworked from all their near work. So those things that we're talking about, kind of more geared towards adults, can apply to kids now, where we haven't seen that before.
And there's even some extensive research about utilizing these devices that will actually alter brain chemistry and change serotonin levels, dopamine levels, and just overall cortisol levels. So cortisol is a really high marker for inflammation and irritation and stress to your overall system. And so when we are constantly being stimulated in those senses, you can just, your systems are pretty much bathed with cortisol, which is a significant irritant, and it changes you chemically, hormonally. I mean, we could talk for a whole 8-week session on the impact that digital devices in our overall society and marketing and advertising have on our kids and on us. So this is a big topic, but yes, there is a big link there between the screen times and like Alexandra said, what kids are watching that triggers these responses inside of them. So does anyone else have any other questions? These are fantastic. Thank you everybody for spurring these topics and discussion points. Looks like we are clear on that. So thank you so much to everybody who tuned in. This was just wonderful. And Dr. Copeland, you are always a wealth of information. We'll have to keep doing more of these because you can tell she's just like skimming the surface with the things that she knows and the things that she can help you with. So I will actually, Dr. Copeland, actually you've got the perfect thing right there. That phone number is a great way to reach her if you have additional questions or ones that are specific to you that you want her to address. She'd be happy to do so. But Dr. Copeland, do you have anything else you want to leave people with?
No, I just really thank everyone for coming in. And then I guess the big thing though is if you are feeling like a lot of people, I think they just feel like their eyes are uncomfortable and that's how they just have to deal with it. So if you are feeling any issues, give our office a call because there's likely something that can be done to make you feel more comfortable using a device or just throughout your day. And like Ellen said, that is my office phone number, and I am in the office for abbreviated hours during everything going on with COVID, but we are here if someone needs to have some help.
Yeah, absolutely. Thank you guys. And if you want to watch this again, because there was a significant amount of information that she went over, and if you want to replay it for somebody in your family or especially your kids of saying, hey, you know how I stop you every 20 minutes and make you look at something far away and go outside? Here's the reason. I'm not just doing it to be a nag. I'm doing it because I care about you and I love you, and this is why. And so this is going to be up on our on MindsetPT's Facebook page. We'll share that out, and I'm sure Dr. Copeland will then share it out with her followers as well. We'll also place it up on our Facebook page, or excuse me, our website, so it has a little bit permanent page and place. So if anybody does want to revisit it, you're welcome to also email me. My email is very easy. It's ellen@mindsetpt.com, and I'm happy to even share the direct link with you if you want to keep that private within your family as well. So thank you so much to everyone for being here, and thank you again to Dr. Copeland. And there's something we say at Mindset. We always say we love you more than you know. So have a great week. Stay safe, everybody.
Thank you.